implantable miniature telescope is a very small pea-sized device that we implant in the eye in a patient with advanced macular degeneration. And Dr. Kammer will talk about sort of the landscape of low vision that we have for patients. But this is a pretty unique device that allows us to take out a cataract and place this device in place of what's called an intraocular lens. And that allows us to then, allows the patient to get a magnified image as if they were wearing an external telescope on their eye. So patients with macular degeneration, they lose the center part of their vision. The peripheral part of the vision is still intact, and so they can't see right in front of them. So what this does is it magnifies the image. So if you're looking out at these three letters CAT, you wouldn't be able to see part of the C, part of all of the A, and part of the T. By putting this telescope in the eye, you're able to magnify the image such that now part of the A is just missing, but the rest of it comes into focus. That comes with a little bit of a compromise, but by doing so, you're able to increase your field of view dramatically from what you had otherwise, and allows for natural scanning vision. So you're able to get a huge improvement in the overall image size that you see, the field of view compared to an external telescope. This is not meant to be a cure either. It's meant to give you functional vision. It's meant to improve your quality of life. It won't necessarily allow you to drive, but it will allow you to watch TV, ambulate, and have better quality of life. It improves your functional vision. Certainly the care is given by a team, and it's really important that the patient understands that they're the central part of that team. Certainly a team approach for this can really have a profound impact on patients with end-stage macular degeneration. And with that, I'm going to invite up Dr. Becky Kammer.
Now with macular degeneration, it's a little different kind of a disease. You don't go totally blind from it. You always have your peripheral vision. But how big that central blind spot or how bad that central vision is, that's what varies over time. So someone with macular degeneration usually doesn't need a red-tipped cane, but they still don't really want someone else to see them with these devices or tools that really show that they have an impairment. So this telescope eye is going to be for very specific things. Now, I've talked about telescope as being for long distance, right? What about reading? What about all these things we want to do up close? Paying my bills, seeing my medicines. Those things are very real, especially as we age. We often have multiple things that we're taking for medications. How do we manage that? Though we want to help somebody with macular degeneration be independent and continue to do the things they want to do. So what are some goals that we could do with this? This plus side is kind of the things that we can expect might be things we could do a little better. Just seeing faces is a huge thing that I underestimated when I first started out in this field. For someone to be able to recognize a friend across the room and not knowing, with macular degeneration, they're often guessing who it is, or they look like they're rude because they didn't respond when the person said hi or greet them when they came in. So being able to see faces is a really important social interaction. A lot of people with macular degeneration actually cut themselves back, don't go out very much, don't interact anymore because of this fear that they're not going to recognize who's coming up to them. So social interaction is a real important one. With low vision devices, they're not usually covered by insurance, but with the implant, it is covered by insurance, most of it anyway, in a big way, and so is the rehabilitation. So here you have a process where instead of having to grab your magnifiers, it's actually inside your eye, and it's been paid for in the system, which is an amazing thing, but does it really work? 4 patients out of those 11 achieved 4 times improvement. Now here's the crazy thing, the telescope only does 3 times improvement. It's a 3x, so how do you get 4 times improvement? Well, part of it, there's 2 reasons. One is they had a cataract beforehand, so their vision was a little blurry beforehand. When we remove the cataract and put a new clear lens system in there, you get a little bit. The telescope itself does the boost. And then a lot of the time, these patients weren't really using their vision well before surgery. They're kind of giving up on using vision, so they're just listening to things. And when we get them actively engaged in working with the vision, things change. The brain connects, and we start to really see an improvement in how they use that vision. It's not that the scar changed, not the retina or the macula, but how they use that vision. It's a powerful thing, even at 90 years old. The average of all the patients did gain 3 times, so we didn't have a unexpected or a less than expected outcome, which is great. But most importantly, all 11 achieved at least 2 of 3 goals that they set. So when you work with an OT and with an optometrist, you're setting goals on what you want to be able to do. I want to be able to pay my bills, I want to see somebody's face from across the room, and I want to watch TV. So let's say those are the 3 goals. So out of those 3 goals, they might have 10 goals, but let's just pick 3. At least 2 of those were met with the telescope, which is very exciting, and for me, I was very excited about these results. And some of the most common goals that people achieved were watching TV, seeing on their computer, which is really, really important. iPad use also. iPads are being used much more in the older population. I love it because it keeps you active, playing games on them and so on, or just communicating. And that was something that was achieved as well. It's kind of in that computer group. It's a very effective technology for the right person, the one who's motivated, the one who understands the pros and cons, is willing to do the rehabilitation, has a support system who's there to encourage them. Our system is a team approach, so we work closely together with patients, also with the retina doctor who's referring them and saying, yeah, sounds like a good patient, and of course the OT. So we do have a good group of people working together for the patient. And it can really have a profound impact on people who have end-stage macular degeneration or with more severe vision loss.
This is a very specialized company. It's been around for approximately 20 years if you include the R&D phase of this device. And it specializes just in, as this slide says, micro-optics for magnifying images. And it's a very specialized field. I was just talking to Mr. Dunbar about it. I mean, if you were to come to our office in Israel, where it was invented and where it's manufactured, you'd see the whole place is basically dedicated to making these micro-optical devices.
One of the things that the patients have to learn early on is it has to learn how to see again, and you've heard something about that from these folks. That's really the objective of the OT, because not only do you have to learn how to handle your sight, you have to learn how to process it. And you spent, in my case, I was, 80 years of age? I spent 80 years seeing the world a certain way. Now I have the world 3 times closer here. I have the world where it was, but it's dead in the center. I don't see anything in the center. And so the mind has to process all that information. The reason I couldn't see my wife's face is I never could look directly at her. I had no central vision. So I saw her out of the corner of my eye. I had to train myself to physically look at what I wanted to see. The point is you have to learn. And the occupational therapist shows you how to do that. And voila, I could see, and it was spectacular. When I was able to look at my wife and actually see her face, eyes, mouth, everything, it was wonderful. It was well worth all I went through to get to that point.